Section 16 of Aids to Forensic Medicine and Toxicology. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Leanne Howlett. Aids to Forensic Medicine and Toxicology by W.G. Aitchison Robertson. Section 16. Chapter 32. Camphor. The liniment, oil, and spirit have been poisonous in large dose. Symptoms: odor of breath, languor, giddiness, faintness, dimness of vision, difficulty of breathing, delirium, convulsions, with hot skin, flushed face, and dilated pupils. Fatal dose, 30 grains. Cocculus indicus. The fruit of Anamirta cocculus. Contains a poisonous active principle, picrotoxin, used to adulterate beer, and by poachers to stupefy fish. Symptoms: convulsions, followed by stupor and complete loss of voluntary power. Chapter 33. Tetrachloroethane, etc. Tetrachloroethane, Ceylon. Acetylene tetrachloride. Vapor has caused poisoning in aeroplane, dope, and cinema film works. Symptoms: gastric symptoms and marked jaundice. This may be followed in days or weeks by stupor, coma, death. Post-mortem: fatty degeneration of internal organs, chiefly liver. Trinitrotoluene, TNT, an explosive solid which stains the skin an orange color, may be absorbed through skin or be inhaled. Symptoms: shortness of breath, headache, drowsiness. Later, skin irritation, gastritis, jaundice, blood degeneration. Treatment: remove from work, rest in bed, diuretics, purgatives, alkalis. Chapter 34. Alcohol, ether, and chloroform. Alcohol, ether, and chloroform induce general anesthesia, often preceded by delirious excitement and followed by nausea and vomiting. When they cause death, it is by inducing a state like apoplexy or by paralyzing the heart. Alcohol. Absolute alcohol is ethyl hydroxide, C2H5OH, with not more than 1% by weight of water. Rectified spirit, Spiritus rectificatus, contains 90% of alcohol. Methylated spirit consists of rectified spirit with 10% of wood spirit. Proof spirit contains a little over 49% of absolute alcohol. Brandy or whiskey, 53%. Port wine, 20 to 25%. Ales and stout, 4 to 6%. Symptoms: acute poisoning, confusion, giddiness, staggering gait, headache, passing into stupor with subnormal temperature, and coma. Vomiting may occur and recovery ensue, otherwise collapse sets in. Pupils usually dilated. Dipsomaniacs suffer from indigestion, vomiting and purging, jaundice, albuminuria, diabetes, cirrhosis of liver, degeneration of kidneys, congestion of brain, peripheral neuritis, alcoholic insanity, and various forms of paralysis. In the acute form, delirium tremens is the most common manifestation. Post-mortem appearances: deep red color of lining membranes of stomach, sometimes congestion of cerebral vessels and meninges, lungs congested, blood fluid, rigor mortis persistent. Fatal dose: death from 1/2 pint of gin and from 2 bottles of port, but recovery from larger quantities. Fatal period: average about 24 hours. Treatment: stomach tube, cold diffusion, electricity, injection of a pint of hot coffee into the rectum. Give chloride of ammonium in 30-grain doses to prevent delirium. Strychnine or digitalin hypodermically. Method of extraction from the stomach. Neutralize the contents of the stomach, if acid, with sodium carbonate. Place them in a retort and carefully distill. Collect the distillate, mix with chloride of calcium or anhydrous sulfate of copper, and again distill. Agitate distillate with dry potassium carbonate and draw off some of the supernatant fluid for testing. Tests. Odor. Dissolves camphor. With dilute, sulfuric acid and bichromate of potassium turns green and evolves aldehyde. Product of combustion makes lime water white and turbid. Methyl alcohol. Wood naphtha. Used to produce intoxication by painters, furniture polishers, etc. Symptoms are those of alcoholic poisoning, but vomiting and delirium are more persistent. Total or partial blindness may follow as a sequel of optic atrophy. A fatal result not infrequently follows. The following table gives the points of distinction between concussion of brain, alcoholic poisoning, and opium poisoning. Concussion of brain. Number 1. Marks of violence on head. Number 2. Stupor, sudden. Number 3. Face pale, cold, pupils sluggish, sometimes dilated. Number 4. Remission rare, patient recovers slowly. Number 5. No odor of alcohol in breath. Alcohol. Number 1. No marks of violence unless person has fallen. History will be of use. Number 2. Excitement precedes sudden stupor. Number 3. Face flushed, pupils generally dilated. Number 4. Partial recovery may occur, followed by death. Number 5. Odor of alcohol in breath. Opium. Number 1. As alcohol. Number 2. Symptoms slow, drowsiness, stupor, lethargy. Number 3. Face pale, pupils contracted. Number 4. Remission rare. Number 5. Odor of opium in breath. Ether is a volatile liquid prepared from ethylic alcohol by interaction with sulfuric acid. It contains 92% of ethyl oxide, C2H5O. It was formerly called sulfuric ether. It is a colorless, inflammable liquid having a strong and characteristic odor. Specific gravity 0.735. Purified ether, from which the ethylic alcohol has been removed by washing with distilled water, and most of the water by subsequent distillation in the presence of calcium chloride and lime. It is this preparation which is used for the production of general anesthesia. It has a specific gravity of 0.722 to 0.720, and its vapor is very inflammable. Symptoms. When taken as a liquid, same as alcohol. When inhaled as vapor, causes slow, prolonged, and stertorous breathing. Face becomes pale, lips bluish, surface of body cold. Pulse first quickens, then slows. Pupils dilated, eyes glassy and fixed, muscles become flabby and relaxed. Profound anesthesia. Then pulse sinks and coma ensues, sensation being entirely suspended. Nausea and vomiting not uncommon. Post-mortem appearances. Brain and lungs congested. Cavities of heart full of dark liquid blood. Vessels at upper part of spinal cord congested. Treatment. Exposure to pure air, cold effusion, artificial respiration, galvanism. Method of extraction from the contents of the stomach. Same as for alcohol. During distillation, pass some of the vapor into concentrated solution of bichromate of potash, nitric and sulfuric acids, and note reaction as for alcohol. Tests. Vapor burns with smoky flame, depositing carbon. Sparingly soluble in water. With bichromate of potash and sulfuric acid, same as alcohol. Chloroform. A colorless liquid, specific gravity 1.490 to 1.495, very volatile, giving off dense vapor, sweet taste and pleasant odor. Symptoms. When swallowed, characteristic smell in breath, anxious countenance, burning pain in the throat, stomach, and region of the abdomen, staggering gait, coldness of the extremities, vomiting, insensibility, deepening into coma, with stertorous breathing, dilated pupils, and imperceptible pulse. When inhaled, much the same as ether, but produces insensibility and muscular relaxation more rapidly. It would be impossible to instantly render a person insensible by holding a pocket handkerchief saturated with chloroform over the face. Statements such as this, which are often made in cases of robbery from the person and in cases of rape, are incredible. Delayed chloroform poisoning. Death may take place in from 4 to 7 days after chloroform has been administered, especially in the case of children. The internal organs are found to be fattily degenerated, and death is thought to be due to acetonuria. Post-mortem appearances. Cerebral and pulmonary congestion. Heart empty or right side distended with dark blood. Treatment. Stomach tube and free lavage. Cold affusion, drawing forward tongue, artificial respiration, galvanism and suspension with head downward, inhalation of nitrite of amyl, strychnine hypodermically. Fatal dose. When swallowed, from 1 to 2 ounces. Method of extraction from the stomach. By distillation at 120 degrees Fahrenheit. The vapor, as it passes along a glass tube, may be decomposed by heat into chlorine, hydrochloric acid, and carbon, the first shown by setting free iodine in iodide of starch, the second by reddening blue litmus paper, and the last by its deposit. Tests. Taste, color, weight. Burns with a green flame. Dissolves camphor, gutta percha, and caoutchouc. Iodoform. Poisoning may result from its use in surgery. It produces delirium, sleepiness, and coma. It may lead to mental weakness or optic neuritis. Chapter 35. Chloral hydrate. It was formerly largely used as a hypnotic, and many fatal consequences ensued. It is prepared from alcohol and chlorine. Symptoms. Deep sleep, loss of muscular power, diminished or abolished reflex action and sensibility, followed by loss of consciousness and marked fall of temperature. Pulse may become quick, and face flushed or livid and bloated. Prolonged use of this drug may produce a peculiar eruption on the skin. Supposed to act in the blood by being decomposed into chloroform and sodium formate. Its effects are due chiefly to depression of the central nervous system, the medulla being the last part of the nervous system to be attacked. Method of extraction from the stomach. By distillation in strongly alkaline solutions, when it may be obtained as chloroform and tested as such. Treatment. Stomach tube or emetic. Hypodermic injections of strychnine. Keep patient warm and inject a pint of hot strong coffee into the rectum. Nitrite of amyl and artificial respiration. Tests. Heated with caustic potash. It yields chloroform and potassium formate. The chloroform is readily recognized by its odor, and if the solution be concentrated, by separating as a heavy layer at the bottom of the test tube. Chapter 36. Petroleum and Paraffin Oil. Cases of poisoning by petroleum and paraffin are common, and occur chiefly in children. Petroleum is a natural product, and is a mixture of the higher saturated hydrocarbons. The crude petroleum is purified by distillation, and is then free from color, but retains its peculiar penetrating odor. Different varieties are sold under the names of cymogene, gasoline, naphtha, petrol, and benzoline. Benzoline is highly inflammable, and is often called mineral naphtha, petroleum naphtha, and petroleum spirit. Benzoline is not the same as benzene or benzol, which is one of the products of the dry distillation of coal. From its very general use as a fuel in motor cars, many accidents have happened from inhaling the vapor of petrol. It gives rise to coldness, shallow respiration, syncope, and insensibility, but seldom death. Paraffin, also known as kerosene and mineral oil, is a mixture of saturated hydrocarbons obtained by the distillation of shale. By the retailer the terms petroleum and paraffin oil are used indifferently, and each is sold for the other without prejudice. Symptoms. These substances are not very active poisons, and as a rule even children recover. The breath has the odor of paraffin, the face is pale and cyanotic, hot and dry, and there may be vomiting. Death may result from gastroenteritis or from coma. Fatal dose. In the case of an adult, 1/2 pint should not prove lethal, and patients have recovered after drinking a pint. Treatment. Emetics, purgatives, and stimulants. End of section 16. Recording by Leanne Howlett.